Ministry of Public Health of Ukraine. Krok 1. Medicine. Year 2017. Number 003. A woman with seasonal vasomotor rhinitis, who works as a train dispatcher and as an outpatient, should be prescribed an antihistaminic drug that does not suppress central nervous system. Name this drug. A. Dimedrol, Diphenhydramine. B. Tavegyl, Clemastine. C. Suprastin, Chloropyramine. D. Loratadine. E. Diprazine, Promethazine. Histamine is a biologically active substance that potentiates the inflammatory and immune responses of the body, regulates physiological function in the gut, and acts as a neurotransmitter. Antihistamines are drugs that antagonize these effects by blocking or inhibiting histamine receptors, H receptors, and they are categorized as either H1 or H2 according to the type of H receptor targeted. H1 antihistamines are mostly used to treat allergic reactions and mast cell-mediated disorders. It is further divided into two generations. First generation H1 antihistamines have a central effect. It can pass through blood-brain barrier, and, thus, are also used as sedatives. They are typically moderately to highly potent muscarinic acetylcholine receptor antagonists as well. Second generation H1 antihistamines have less central effects, less of sedating effect, and are primarily used as anti-allergic drugs. They are zwitterionic, very polar, at physiological pH, around pH 7.4, so that they are less likely to cross the blood-brain barrier, acting mainly outside the central nervous system. Less central effect. H2 antihistamines are indicated primarily for gastric reflux disease, because they reduce the production of stomach acid by reversibly blocking the H2 histamine receptors in the parietal cells of the gastric mucosa. Most H1 and H2 antihistamines are contraindicated during pregnancy and childhood. First generation H1 antihistamines are specifically contraindicated in angle closure glaucoma and pyloric stenosis. Diphenhydramine, trade name Dimedrol, is a first-generation H1 antihistamine mainly used to treat allergies. It can also be used for insomnia, symptoms of the common cold, tremor and Parkinsonism, and nausea. Chloropyramine is a first-generation H1 antihistamine to treat allergic conjunctivitis, allergic rhinitis, bronchial asthma, and other atopic, allergic conditions. Related indications for clinical use include angioedema, Quincke's edema, allergic reactions to insect bites, food and drug allergies, and anaphylactic shock. It has H1 antagonistic properties and some anticholinergic properties. Promethazine is a first-generation H1 antihistamine. It is used to treat allergies, trouble sleeping, and nausea. It may help with some symptoms associated with the common cold. It may also be used for sedating people who are agitated or anxious. Common side effects include confusion and sleepiness. Alcohol or other sedatives can make this worse. Clemastine, trade name of Tavegyl, is a first-generation H1 antihistamine with anticholinergic properties, drying, and sedative side effects. Loratadine is a second-generation H1 antihistamine, whose selectivity significantly reduces sedative effects while still providing effective relief of allergic conditions. The answer should be a drug categorized in second-generation H1 antihistamines because it is for allergic reactions without central effects. The answer is D. Loratadine.